Hey everybody, it's Dr. Sam Robbins, and today's topic is how vitamin D can cause a heart attack or stroke. I mention this because I was recently at a dinner party, and this guy was telling me how it was a discussion just at the dinner table, not necessarily talking to me. And he said how he had low vitamin D levels, so he started taking supplements, and his vitamin D level was good. And he's saying all the problems associated with low vitamin D and so forth. If you've watched any of my previous videos, you already know. And then he said he had to stop because a doctor friend of his said that vitamin D can cause plaque buildup and therefore cause a heart attack or stroke. So he immediately got off and he said, and I said, really? That's it? That's what the doctor said? He said, yeah. And I went on YouTube and I did research, and lo and behold, that's what I found. Now, keep in mind that whenever someone does any research for anything, they have a bias. So if you love your car, you're going to tend to search that car and have positive feedback for that one car versus some other thing. That's just an example, right? So he's like, hey, you're not stupid enough to take vitamin D, because he knew how I was into health. And I said, why? He says, it's just a matter of time. I said, yeah, I'm taking it because I had low levels and I don't get enough sun. And even when I do, it's just I'm older and just body doesn't produce enough vitamin D. And I'm trying to watch all the wrinkles, so I'm not getting as much sunlight anymore. And he said, well, dude, you're not stupid enough to take it. And I said, yeah. And then he said, well, dude, it's just a matter of time before you get a heart attack or stroke. And I said, look, I've done a calcium score. I even did a heart MRI, when I turned 50 and did all this stuff. Everything is perfect, clean as a whistle, open as can be, 0%. And that's when he says, it's just a matter of time. So, your dinner party, you're not going to say much. So today I'm going to talk about, is what he said true or false? So let's get started. So first of all, let's talk about vitamin D3 and calcium. Now, studies have shown that high dosage of vitamin D3 can lead to too much calcium in the blood, potentially causing an arterial hardening, right? And therefore plaque buildup and then the narrowing of the arteries and so forth. Now, conversely, on the other hand, calcium does obviously improve bone density for your teeth and your bones and so forth. But again, too much can increase a risk for heart disease or so forth. Now, understanding the risk here, vitamin D3 is essential, as I've said, over-the-counter supplementation. If you overdose, in some studies have shown it's caused hypercalcemia, and which is basically high levels of calcium that some doctors will warn you about. However, many people, including myself, have high levels of vitamin D without the elevated calcium. As I said, I did the calcium score and did a heart MRI. So the medical guidelines are basically flawed. All right. Now, let's talk about the role of vitamin K2. If you've watched any of my videos, vitamin D3 works with K2 and it helps regulate the calcium in the body. Basically, vitamin D3 helps absorb the calcium, and then K2 helps direct it to the right places, such as your bones, your gums and your teeth and all that stuff, and not in the arteries. So supplementing with K2 along with the D3 is very important for reducing the arterial calcification and maintaining cardiovascular health for your heart and your brain. So if you care about the details, basically how it works, just some key points. It's called osteocalcin, which helps bind calcium to the bones, promoting bone health. And there's also something called MGP, which stands for matrix GLA protein, which prevents the calcium from depositing in the arteries and keeping them flexible, right? All right. So what are the action steps for you? Basically, if you're going to take vitamin D3, especially at a higher dose, anything, that is going to actually increase your vitamin D levels in a blood test, you should be taking it with also vitamin K2. Vitamin K also has a lot of other health benefits. They're both fat-based vitamins, K and D. Actually, vitamin D is actually more of a hormone, not necessarily a vitamin. So that's something to know. That's why it's so powerful and so important. If you're getting the sunlight, which is where you get most of the D That's great. Your body knows what to do with it. Too much this, too much that, this and that. But most of us are not getting enough sunlight. And even though we get older, different hormones, if you have higher body fat, if you have darker skin, if your hormones aren't optimal, you require a lot more sunlight, and you need sunlight. You don't want it on your face and hands. That's going to cause the wrinkles. You want it all over your body, at least 30 to 45 minutes every day. If you're a surfer, fantastic, right? If you're living on the West Coast or wherever. But if you're most of us, you're indoors all the time, you're not getting enough sunlight. So you do need to take vitamin D3 supplementation. And therefore, you have to be conscious of this, and therefore you need to take it with vitamin K2. Now, the ideal form of K2, there's different versions, but there's MK4 and MK7, but the preferred K2 supplement is the MK7 that has a longer half-life and better absorbability. Now, I use the patented MenQ7, which is MK7, and the trans-menoquinone version. I always misspeak that one. So that's the one I take. Now, the ideal ratio of it is basically like a 2-to-1, vitamin D3, 100 mics to 50 mics of K3. Basically what I do is I take 5,000 units of vitamin D3 along with about 50 micrograms of the K2 and the MK7 version. Now, I take a product called Perfect Vitamin D3 plus K2. Why? It's got the correct ratio. It's also it's vegan form, and it's also plant-based and microencapsulated for better absorption. It doesn't go rancid like most of the D and K, which comes in an oil caplet. These are capsules, vegan, vegetarian, plant-based, higher absorbability, and basically I take 2 pills a day because I need more to get my blood levels up. Most people just need 1 pill. So 1 bottle of Perfect Vitamin D3 K2 lasts you at least 3 months. So that's the benefit. Now, my mom's genetic, she only needs 1. For some reason, she's 85. That's all she needs to get her optimal blood test levels. I need 2 a day. Now, just in case you're like, hey, how do I do this naturally? I don't want to take pills. As I said, vitamin D comes from the sun. Most of us are not getting enough sun. The vitamin K, you need to eat a lot more animal protein and organ meats and whole eggs and so forth. Again, most people are not doing that. That's why it's just so much easier to take it. And if you're taking a multivitamin, it's usually not enough. So again, as I stated, I take the 5,000 micrograms of D3 with about 100 or 50 to 100 micrograms of K2, the MK7. I take Perfect Vitamin D3 and K2. I put the links below for discounts. You can go buy it or just source it on your own. So there you have it. Add it. Don't worry about it. It's not going to cause plaque buildup, heart attack or stroke or any of that stuff. Again, always speak to your doctor before you do anything, but I've been doing it for a long time. I have 0 calcium buildup. I've never had any people doing it, but people who take high doses of vitamin D3, I have heard people getting like little bone growths, and that's a little calcium buildup. Now they can't really test their hearts at that point because they can feel lumps. I've given it to a friend of mine. I said, dude, lower the vitamin D3, immediately add in some K2, and then the bone spurs and everything disappeared. So there you go. I hope this was helpful. Share it with someone. If you found it helpful, don't forget to subscribe and go down below in the description area for additional information on how you can optimize your vitamin D3 and K2 levels.